Good morning. Today's hearing is being called pursuant to the subcommittee's oversight responsibilities regarding regulatory reform and the administrative state. Our concern is that in response to the COVID pandemic, the administrative state, particularly leadership at the Food and Drug Administration and the Centers for Disease Control and Prevention, operated outside of their own rules, regulations put in place to guard against such behavior in the face of a national health emergency. Subcommittee oversight has found that in the wake of Operation Warp Speed, a federal effort to speed up COVID vaccine development, there were reports of vaccine injury. Further, the FDA and CDC had not studied whether people who had been infected with COVID even needed a vaccine or whether the vaccine would, quote, stop the spread, end quote. When the Biden administration took over in January 2021, the emergency use vaccine was being rolled out. Though the positive and negative effects of the vaccines were just beginning to be understood, there was immediate talk of mandating the vaccine and developing vaccine boosters. Let's be clear, the mantra since the first days of the COVID-19 pandemic was that the government would follow the science in all aspects of the pandemic response. But the administration's objective from the beginning was to act with more urgency than caution. Frightened Americans were working together to try to keep one another safe, and they relied on the government's flawed advice on how best to do so. Through Operation Warp Speed, the FDA brought emergency use authorization, or EUA, vaccines to market, but these vaccines were not fully approved or licensed. From the beginning, the CDC issued guidance suggesting that those who had already been infected with COVID would benefit from the EUA vaccine. The science, however, did not support this. CDC's reporting did not take into account that those who survive infection usually develop natural immunity. After reading the CDC's Morbidity and Mortality Weekly Report, which contained the most current COVID vaccine data at the time, I called the CDC and questioned the validity of the report. As the recently released subcommittee report details, the administrative state at the CDC circled the wagons. Rather than being receptive to my correction of their admitted miscommunication, CDC officials doubled down on the claims, warned members of their team, private citizens in fact, that I had called and refused to make the changes they said they would make to the report. We know through other committee oversight that the Biden administration eventually grew so bold as to seek censorship of vaccine critics. As for mandating vaccination, full FDA approval, not emergency use authorization, is needed to force someone to take a vaccine legally, as has been the case with vaccines required to attend public schools and colleges. Acting FDA Commissioner Janet Woodcock began working on getting a fully approved COVID vaccine in early 2021. Pfizer filed their Biologics License Application, or BLA, to seek full approval on May 12, 2021. Under normal circumstances, a BLA takes a year to complete. A fast-track BLA can be ready in about 8 months, which meant full approval by January 2022. Working on the vaccine license approval were Dr. Marion Gruber and Dr. Philip Krause, both who have about 30 years, 3 decades of experience in vaccine reviews, 2 of the world's best and most recognized scientists in vaccine licensing. Dr. Gruber and Dr. Krause strongly supported vaccines and were relied upon by the World Health Organization for guidance and advice during the pandemic. These 2 scientists, working alongside a team of experts, committed to completing the BLA in only 4 months, by September 15, 2021, something that they explained would be unprecedented. Overseeing the operation with Acting Commissioner Woodcock was Dr. Peter Marks, Director of the FDA Center for Biologics Research and Development. Drs. Gruber and Krause reported to Dr. Marks. As we know, vaccine injuries were already being reported in 2021, including instances of myocarditis in healthy young people. Drs. Gruber and Krause were aware of the reports, but wanted more time to evaluate the data. Dr. Marks asked them to move the BLA completion up 3 weeks, which would be in line with Biden's expected mandates. Drs. Gruber and Krause explained that moving the approval date up would mean cutting corners and lowering standards. But Dr. Marks told Acting Commissioner Woodcock that he had Operation Warp Speed to live up to. They then removed Dr. Gruber and Dr. Krause from the licensing application review. The top 2 experts at the FDA, taken off of the job because they wouldn't do what the politics wanted them to do. After the FDA rushed the licensing process and began promoting boosters and expanded the vaccine authorization to include children, Drs. Gruber and Krause expressed their concern in a Lancet Medical Journal article about the boosters. Pfizer released a video encouraging people to get their vaccine because it works against then-recent Omicron variant, despite not having the data to back it up. Take a look. We play the video.
You know that unwelcome guest everyone wishes would just leave already? That's COVID-19. That's why I got the new updated booster, designed to help protect against recent Omicron variants. Got it?
We'll talk about this video later. There were some things missing there at the end. Soon after, the FDA and Dr. Marks created 41 videos to assure the public that the vaccines were safe. In one video, Dr. Marks suggests that there is no harm to fertility, although he actually did not have data to back up the claims. Let's take a look at that video.
Pregnant or breastfeeding women can certainly receive a COVID-19 vaccine and should discuss the potential benefits and risks of vaccination with their healthcare provider. There's currently no evidence that any vaccines, including COVID-19 vaccines, cause fertility problems in either men or women. If you're pregnant or breastfeeding, or might become pregnant in the future, the CDC recommends getting vaccinated.
At the time he made that video, he knew that there were reports that the vaccine affected menstruation cycles of women. In another video, Dr. Marks talks about reporting of side effects and says there's a mechanism in place to report injuries. He claims the benefits outweigh the, quote, known and potential risks, unquote. Let's take a look. In another vaccine promotion video, Dr. Marks advocates giving the EUA vaccine to children as young as 6 months. No COVID-19 vaccine had been approved for children that young, and the vaccine had not yet been tested on that population. Let's take a look at that video.
In FDA's analysis for both the Moderna and Pfizer-BioNTech COVID-19 vaccines, the immune response to the vaccines in each age group of children was comparable to the immune response of the older participants. The immune responses showed the vaccines were effective in preventing COVID-19. The FDA's evaluation and analysis of the effectiveness data of these vaccines was rigorous and comprehensive. For the Moderna vaccine, we evaluated data for multiple pediatric age groups. For each age group, FDA evaluated effectiveness data based on randomized placebo-controlled studies in which the immune response of children in each age group following 2 doses of the Moderna vaccine was compared to the immune response of adults aged 18 through 25 who received 2 higher doses of the vaccine in a previous similar study which determined the vaccine to be effective in preventing COVID-19. For the Pfizer-BioNTech COVID-19 vaccine, the effectiveness data to support the EUA in children 6 months through 4 years of age are based on a comparison of immune responses following 3 doses of the Pfizer-BioNTech COVID-19 vaccine to the immune responses among individuals 16 through 25 years of age who received 2 higher doses of the Pfizer-BioNTech COVID-19 vaccine in a previous study which determined the vaccine to be effective in preventing COVID-19. Please talk to your child's healthcare provider about any questions you have.
Dr. Gruber's full testimony is being entered into the record, but I'm going to share part of it with you now. So I asked Dr. Gruber, So you had given them a September 15th date, which you considered to be, I think, very aggressive compared to prior timelines for other vaccines. Is that correct? Dr. Gruber said that is correct. And who was pushing you to move that date up? It was Dr. Marks. You said that in your email there are very important regulatory issues that need to be settled. And as an example, you mentioned a pediatric plan. Can you explain what that means and what needed to be settled? Why was the BLA approval dependent on the pediatric plan? Because it required by law that a vaccine manufacturer will assess the vaccine further in the pediatric population if they have not been tested as part of the efficacy study. As I recall, in the efficacy trial, there were adolescents and children, I think, down to 12 years of age, but the vaccine was not tested in children less than 12 years of age as part of this efficacy study. So a vaccine manufacturer then has to put a document together describing, even though the vaccine was ready for approval in an older population or the adult population, that it would conduct further studies to evaluate the safety and effectiveness of the product in pediatric subjects. So that's the Pediatric Research Equity Act, PREA. That is a law that vaccine manufacturers and by implication FDA has to comply with. So we had to review the documents that Pfizer submitted delineating the type of subjects they would be conducting in pediatric studies they would be conducting in pediatric subjects. And that, of course, and this is what I stated in my email, was important because safety in younger populations is even more paramount than in older populations. I then asked her, you mentioned that the pediatric plan was becoming increasingly complex. What was complex and how did the FDA and your team adapt to those complexities? Dr. Gruber said, so by definition, pediatric subjects go until age 17, including age 17. And as we discussed earlier on this morning, we had become aware of data suggesting a risk of myocarditis. And this data became apparent because the vaccine was rolled out and the EUA. And of course, there were post-EUA surveillance systems in place by the CDC and the FDA. And they showed it was for myocarditis and pericarditis in younger adults, but also adolescents, young males, and 12 to 17-year-olds includes the pediatric population. So we had to discuss with the sponsor, that was Pfizer in this case, given that identified risk, what further studies did need to be conducted if we were to license the product in the post-marketing space to further assess that risk. And this is referred to as a post-marketing required studies. I asked her, and that is complex in a way different from prior vaccine approvals? Dr. Gruber replied, the difference was that we became aware of this risk of myocarditis. If there would not have been this information and this data, there would not have been a need to require Pfizer to conduct post-marketing required study to further evaluate the safety signal as the regulations prescribe. And so we also had to review proposed protocols for that further post-marketing required study. And that also comes with, they have to give us a date when they're going to initiate this trial, when they're going to conclude these studies. So this is where review activities were ongoing at that time. And I asked her, and that's part of the timeline that Dr. Marks was asking you to compress. Dr. Gruber said yes. So our counsel said, so it's fair to say that you were it had been raised, I'm sorry, our counsel asked, so that it's fair to say that it had been raised that to you that the data regarding myocarditis or the pericarditis side effects, you determined that based on the data before this July 19th meeting. Is that timeline accurate? Or could you elaborate on when you had found out about myocarditis side effect and relevance to this meeting? Dr. Gruber said, the vaccines were rolled out under EUA and the decision to authorize the Pfizer vaccine was made in December 2020. The FDA and the CDC set in place post-EUA safety surveillance systems, and the vaccine was rolled out and administered to a large number of subjects in the United States. These safety surveillance systems picked up this risk of myocarditis, and of course, the sponsor was well aware of this group. So you mentioned that Dr. Marks and Dr. Woodcock both mentioned mandates, vaccine mandates to you. Is that something inside of FDA's purview? And should that be a consideration that you have to take into effect when you're deciding whether to issue a license or not? Dr. Gruber replied, I was never made aware that this is a requirement. And as a matter of fact, that subject had never come up in vaccine licensures before. So I asked her, so is that why you memorialized it in this letter, that they were mentioning mandates and this really wasn't part of your job? Dr. Gruber said yes. When you left, and you can see this on the slide here, she memorialized in an email that they were being pressured to license these vaccines so the mandates could happen. I asked her, when you left, who was appointed to take over your responsibilities? Dr. Gruber said, that's Dr. Marks. And who appointed him? Dr. Woodcock. So Dr. Gruber testified that further testing was required in order to approve the vaccine for children. Yet Dr. Marks and the FDA promoted EUA vaccine for use on children without properly testing it for safety and efficacy. The Biden administration was mandating the vaccine on the military and young people going to school despite a lack of testing and data, despite growing reports of vaccine injuries. This kind of decision-making by the administrative state is concerning. The FDA should not have approved the vaccine for children, EUA or otherwise, without proper testing. Injury from COVID vaccination is real. The New York Times recently profiled several people who, in the prime of their lives, suffered from vaccine injury. Had the risks been known or shared, many of these injuries could have been prevented. Dr. Woodcock says she is disappointed in herself for this, as she should be. It's our job in Congress to oversee government agencies. When agents of the administrative state are not doing their job, they must be held accountable. This hearing will give us an opportunity to discuss this with an eye toward legislative reform. Think about this. Right when they were getting the warnings that myocarditis and pericarditis were real and serious side effects to the vaccine, and they had already agreed, the top scientists at FDA had already agreed to compress the schedule as much as possible. Right when they got the message that there were serious side effects, and Peter Marks, instead of telling them, we're going to give you more time to study this, he told them to compress the schedule even more. And when they said that compressing the schedule was not possible, he fired them. He took them off the job, assigned them to other duties. The top vaccine officials who've been there for 30 years, taken off the job because they wanted more time to study the effects of the vaccines, and they were told that they needed to do this quickly because they needed to be mandated. With that, I yield to the ranking member for his opening statement.